Thanks very much. It's a real honour to be addressing you this morning. So my name is Tim Kelsey. I'm the National Director for Patients and Information in our National Health Service. And it's a big privilege. That job brings together the functions of Chief Technology Officer, of Chief Information Officer, and a responsibility for all the patient and public work we do. And really, my role writ large is to find new ways of, frankly, unleashing the power of patients. I'm going to talk a bit about that in a minute because we can't do that without your help. But this is about giving people real control over their health and care, helping them become absolutely fundamental to the way in which decisions are made about their local services. And if I can put it this way, to kind of create an authentic culture of people participation in healthcare. As Ed just mentioned, before I did this job, I was the Prime Minister's advisor on transparency and open data, and it was another massive privilege. And I think that what we're doing in health, I hope, will be a kind of an exemplar that other public services can follow. We are at a turning point. We all can feel that. And I personally believe that open data, transparency, in fact, open government more generally, is going to be the most important public policy contribution of our generation. And public policy feels a long way from economic value or from entrepreneurial interest, but they are the same. They are aligned in the work that we're doing. If we can't demonstrate social value in the creation of new markets, new opportunities for entrepreneurs, then we will all collectively fail. So in that sense, my job is to make the case for the knowledge revolution. And I'm in health, so I'm going to talk about health for a bit. But actually, I wanted to talk first about weather, because although the evidence for the economic case in open data and open government is relatively thin, this is a new thing. It is a new revolution. We've really only been observing its benefits in the last kind of 5, maybe 10 years, but most focusedly in the last 5 years or so. And I can't give you a figure that's authoritative that says, open data and health is going to be worth X. Figures have been attempted. McKinsey said it would be worth, in the US context, $300 billion per annum to open up the value of the data assets held within the US healthcare system. Well, that may be right, it may not be right. I used to work at McKinsey, so of course I have real respect for that figure. But the truth is we don't really know yet. So a lot of work's going on right now about the value of this data. But there are some glimpses, and I don't know how many of you will have heard the story of weather, but one of the things I did when I was in the Cabinet Office here was to work with our own meteorological office to release weather data. Sounds bizarre to say it, but up until last year, data from all the 5,000 forecasting stations we have in the UK wasn't available as open data to people to be able to mash up with other sources of data and start producing products and services for the general public. And my argument, in fact, for doing that wasn't just the moral imperative of open data, it was a very real economic argument, which went along the lines of 50 years ago in the US, bravely, the US administration took the decision to release their weather data. They didn't do that just because they wanted a weather channel, if they could have imagined one at the time, but they did it because it enabled the consolidation of agriculture. At the time, there were lots and lots of small farms. America was a net importer of agricultural product. And one of the problems was these farms couldn't survive a bad winter and consolidate, mainly because the insurance industry wouldn't provide products that were affordable to small farmers. The reason they said they couldn't do that was because they couldn't forecast the weather. So the American government made the weather forecasts available, or the ability to do that. The insurance industry provided affordable products to farmers, and the net result was the consolidation of American agriculture, and in due course, America becoming a net exporter of food. And this is a very real trajectory, open data leading to such important economic growth. And on its own now, the weather derivatives marketplace in the US on its own is worth $3.8 billion. So my argument originally about weather data here was how much of a slice do we want of that market in Europe as it develops. Anyway, just a tangible example of a way in which public service value, economic value all go hand in hand. So moving to health, as the previous speaker said, the NHS, broadly put, is a very, very large thing. It's actually the 33rd largest country in the world. We're bigger than Argentina or Poland. It's a massive enterprise, spends broadly £100 billion a year. And we do not yet we haven't really engaged yet with you. We haven't engaged with innovators in data, in technology. We haven't opened the industry up in the same way as other retail industries have done. And of course, these analogies are very imperfect. Health is a very different kind of beast to, say, banking or travel. But what we can see in say, retail financial services, I'm sure many of you are very active in that world, is that the simple combination of transparency, of personal data, and the ability to use it, to participate through it, led to a massive reduction in cost in delivery of the financial services that were being provided, and equally almost unprecedented improvement in customer satisfaction. One of the interesting things for me about online banking is the degree of the way in which it sort of became a kind of social movement. And I think in a very real way, it's one of the most obvious examples of the speed with which people can move if they're given an advantage through data. And the figures are as follows. I don't know if you know these, but it's worth remembering them. 1998, we had the first online bank in the UK. There was lots of skepticism. People were profoundly uneasy about the idea that somehow personal data might be managed digitally, privacy and so on and so forth. Would the banks be successful in accurately identifying everybody? Anyway, today, more than 22 million adults in this country, very nearly, well, more than half of the adult population only do online banking. It is a social revolution of a kind, just a quiet one, but of a kind that, to be honest, it has been unprecedented in our society. And it's all been about getting access to our own data and being able to analyze it. Now, in healthcare, we have a particularly urgent need to grasp this nettle of personal control through data because we are going to run out of money very, very soon. So, broadly put, the most recent analysis that NHS England, the body I belong to, has done suggests that within 5 years, we will be short by about £30 billion for the health service. Just a variety of factors, ageing, science, the cost of science and so on, will force the costs of healthcare up by about £30 billion. And that gap, that £30 billion gap on current spending, will not be met by the Treasury reaching into its pocket and giving us more cash. We think probably around 40% of that gap can be met through pay restraint, but the rest, frankly, is going to be up to us. The rest is about unleashing the power of the patient. It's about making real use of technology and data, in empowering people to take more care of their own health and to be able to engage much more directly in helping us direct and design services more efficiently for local communities. So it's kind of, if we can get this right, I believe that the NHS has a long-term sustainable future. It's exactly the same challenge that faces every developing Western health service or developed economy health service. They're running out of money. The option finally is to reach out to the customer and ask them to participate in healthcare. It sounds so obvious, but it just really hasn't happened anywhere so far. So we are stepping in to a really new world. We don't know what the journey exactly looks like, but I am sure it's going to be a journey which will unlock a wholly different approach to healthcare. So I'm just going to talk about three broad pieces here. One of them is to do with what we're doing with big data. So you've heard a bit about that already, but we have some very hopefully exciting plans for transforming the availability of just the raw material that you can go off and develop your apps and services with on a scale that has not happened anywhere else in the world. Right now, we have a thin trickle of data that flows out of the health service, which comes from hospitals, and we call that the Hospital Episode Statistics Database. It's a thin trickle. It captures a small percentage of the activity that takes place in hospitals. Our plan is to liberate all the data in our hospitals and liberate all the data in our primary care services and enable those to be safely linked anonymously so that we can give that data out to you as open data, and you will then be able to develop a whole range of new generation tools and services for patient and professional benefit. Now that sounds like good rhetoric, and I have to say, when I took this job, my first ambition was to make this, was to actually make it happen. We've talked about this kind of data revolution for so long, and to be honest, we've only taken faltering steps. So I'm really pleased to tell you today that that linkage service will start next June. You will be able to get access to a linked file of data which will link hospital and primary care services There is nowhere else in the world that has done that on such a scale, and I'm hoping that this will be the fillip that industry entrepreneurs have needed to kind of develop a range of different sort of service. And let's just reflect on what one or two of those might look like. So the first is we have a almost total absence of insight into some of the most important pieces of our healthcare. I mean, one example is as follows. Chemotherapy treatment. Broadly, the NHS spends about £1 billion a year on chemotherapy treatment. That is 1% of our spending. Tens of thousands of people receive chemotherapy. And do you know what? And it's a point of national shame. I could not tell you now how many people actually receive chemotherapy, nor with what outcome. In fact, no healthcare system can tell you that. We are giving people toxic drugs, and we don't really know, in large part, whether they're actually getting better or not. And that's because of the absence of data. Systems just do not collect that data, do not share it within themselves. But imagine the opportunity to provide individuals with tools that they could use to assess the impact of their treatment just on chemotherapy. And that's just one example of an absence which we intend to fill. And our job is to simply make the data available. The data being available is of no value to anybody. The benefit comes only when you guys get properly engaged and start turning that data into accessible tools and services. And to make it absolutely clear, we in the NHS do not believe that's our core skill set. We are not about to go competing with you to develop visualizations of data or the algorithms that will draw sense from the underlying assets. That's for you to do, and if you don't rise to the challenge, then we're all stuffed. Yeah. The other big benefit, which just again to think about, the other big possibility that you might want to reflect on is the whole sort of, this big data set is, I think, a very big part of the answer to the science problem we've got. You know, we've kind of hit a wall with life sciences a bit where the randomized controlled trial feels like it's beginning to run out of steam just because of the way in which life is so complex in the real world. And what most life sciences companies, and particularly those involved in genomic research, really want is real-world evidence, stuff that helps them understand what actually happens to real people over time when they're taking a cocktail of different drugs, they're in and out of hospital. What actually happens? How can we look at their outcomes? And that will be something that also flows through this new data service that we're developing. And I'm optimistic, actually, this will help, I think, draw jobs, innovation to the UK. I think it'll help put the UK on the map in terms of genomic research. The Prime Minister here has already committed to the UK developing 100,000 gene sequences very rapidly, but those sequences on their own will be of very limited value without the kind of reference data that lies out there in the real world of the NHS, the data I've just said we're going to start making available properly from next June. So hopefully that will be very inspiring. These are very, very high value, high social value as well as commercial value opportunities, and I really encourage you to take a look at them. The name of the program, by the way, is care.data, and if you'd like to know more details, then just tweet me and we'll make sure we get those details. A second big area for me is kind of a related piece of big data. And this, I think, is a marketplace for innovation that people sometimes ignore or forget about. And this is to do with big data that flows out of the patient. So I know where I've talked about big data coming out of the clinical pathway, but what I now want to talk about is data that's coming out of the customer, the patient, the user. And this has been a really big focus for us in the British NHS or the English NHS. So, for example, in April, we launched something called the Friends and Family Test. Many here will know that as the Net Promoter Score, a simple question asked of patients, you know, would they recommend this local service to their friend or family member? And we've had an overwhelming response to this. We're about to make a really amazing announcement of the number of people who've participated, but it is in the hundreds of thousands of people who are just really interested and supportive in wanting to give their feedback on local services. There are quite literally millions of comments now being volunteered by people as to the quality of local services. And this is a massively important information resource for doctors, for patients. You know, it's kind of TripAdvisor, but in healthcare. And we're beginning to build an awareness of how important that can be, but we still don't have the richness of the apps and services that you can help us with surrounding that data source. So one data source you might want to have a look at is what use could you make of the Friends and Family Test? It's flowing through the system. It's easy to get access to at very basic open data levels. You might want to have a look at that. And on the back of that, to be honest, on the back of that revolution and sort of inviting the voice of the patient to be at the heart of the way we plan our services, we've launched another pilot service called Care Connect. And for those of you who are from the US, you'll all be very familiar with something called 311, which is the way in which local cities responded to some of their economic and social challenges. They invited the citizen in. They asked them to ring 311, email it, tweet it, in order that they could give their feedback and services could be improved in real time. So we've kind of adopted that as a scenario. It's been incredibly effective in the US, and we've landed that now in the NHS. And Care Connect launched as a small pilot, allowing people to ring, tweet, comment, email their thoughts on local services. We developed it with My Society. That launched in London with 17 hospitals in London a month or so ago. It will be going national next year. And we're looking again for a broad coalition of partnership with for and not-for-profit entrepreneurs to help us make the best sense of that we can. Again, if you'd like more details, let me know. And then finally, I just want to reflect on two things. Again, I think these are big economic as well as social opportunities in healthcare, which you might want to reflect on. One is my data. So a very big part of taking a leaf, in a way, out of the online banking book, with all the caveats about banking not being like healthcare, we are very focused, committed to giving every patient access to their own data. It is their data. We must, first of all, of course, respect their privacy, but with consent, we want them to be able to have access to their own data, and not just have access to it, but to be able to do things with it, to mash it up with other data sources, to get their local retailers to tell them about their purchasing habits so they can mash that up with their health data. And this is the kind of challenge that so many people have developed services around already, wellness tools, apps to help people with long-term conditions, yet the core data that will enable that to be incredibly effective has yet to flow. And we think that we're going to be making a very big offer in that regard. So just a date, from next April, every citizen in this country will be able to, if they wish, access online their medical record. And please go away and come up with some decent services to give them the best opportunity they can to do that. We're literally just going to be making that happen, and we need people to do some immensely intelligent and creative things with that opportunity. The other thing is we're going to be opening up NHS Choices. Now, for those who know it, NHS Choices is I designed it, I have to admit, a bit of a conflict of interest a few years ago, but it's an online information service, and it currently has recently passed this rather amazing milestone of having 1 million unique users every day now. So it's got broadly 30 million unique users each month, making it by far and away the largest health information platform of its sort. And we're now going to open it up to colleagues and collaborators, innovators of all sorts, with the most minimal kind of accreditation requirements. And we want you to please come knocking at the door of Choices. It's a wonderful platform. Those 30 million people, by the way, are predominantly British. I mean, very, very predominantly British. So you're talking to the nation, as it were, in relation to their health. It's a great opportunity. We want you to bring your innovation to bear on it. There are lots of challenges in making this vision real for the community as a whole, whether that's a patient or an entrepreneur or a scientist or even, of course, a clinician. And one of those big challenges we've got is interoperability, is building a health service that can speak shares the same currency within itself. Generally speaking, health systems have been developed in the absence of any standards that will enable the free flow of things like open licenses and open data. And one of the reasons why open data has been slow in public services has been because it's been so hard to kind of just create a common currency. But again, we are committed to doing that. And this, again, might be an opportunity to think about. We've just basically injected £1 billion, all told, into supporting our trusts, that's mental health as well as hospital trusts, community service trusts, to step up their game in terms of digital record keeping. This is a huge investment in the future. It's a huge incentive to wrap around the collaboration between the NHS and entrepreneurs to start building new digital infrastructure. It's called the Tech Fund. People can find out more details about that online, but if you're not already aware of it and you'd like to be kept abreast, we run a thing called Entrepreneurs Day, which is a kind of network to make sure that small business, large business, everybody is fully aware of the opportunities we're making as we go along. So again, if you'd like to find out more about Entrepreneurs Day, let me know. I'm going to finish with a story, which just, I think, brings all this home. Brings home the opportunity of the economic and social, the opportunity we've got. And that is this. I try and, as much as I can, get out and meet and ground myself in the real world. It's really easy to get lost in the rhetoric of change. And I was with some people with learning disabilities a few weeks ago, so just fantastically visionary people who, struggling with real personal difficulty, but making fantastic human sense of the world in which they were living. And there was a very, very disabled girl whose mother was sitting next to me, and she was, you could see in her face the incredible kind of cost to her of being a carer on the one hand, and of our health system being so deeply poorly attuned to her needs as a person. Her daughter would be having a crisis pretty much on a daily basis and forcing her to take her daughter into hospital. She would go to the emergency department or the accident emergency department, and she would be required to fill in forms over and over again, even though she was there pretty much every day. The hospital had no institutional knowledge of her, did not know who she was, had no means of giving her the convenience of a kind of easy re-identification, if I can put it like that. Having filled in the forms, of course the doctors knew precisely who she was, but not the institution itself. Having filled in the forms, she would then routinely be admitted to a ward where her daughter would then sit in her wheelchair for several hours often, waiting for the hoist to arrive that would pick the daughter out of the wheelchair and stick her on the bed for treatment. And in the hours she spent just waiting around the NHS, where, by the way, she'd formerly worked as a nurse, her personal sense of worth was being degraded, and she was finding it very, very difficult to cope. And I said to her, what's the one thing that I could do to help you? And she said, you've got to make the health service remember who I am. And broadly put, that's the challenge of all this. It's the development of a truly personal, dignified approach to healthcare. That's what this is all about. Open data is about a set of values that says we value we have human values, we value people. So I'd like to leave you with that thought. Thank you very much.